Good evening and welcome to the Deep South Center for Environmental Justice virtual training on COVID-19. The purpose of this training is to provide and raise community awareness about this pandemic that we're in, and specifically steps that people can take to protect their health at this time. This is part of a series of trainings we're conducting on Zoom of this summer. Our first training took place on June 9th, which is why you see the date there. And we'll be continuing those trainings to the end of this month. And so the next upcoming trainings will be on Saturday, June 27th at 12 noon, followed by a special COVID-19 community awareness training that brings it into steps that people can take in this time of where we are with hurricane season for disaster preparedness. That takes place on June 30th at 6 p.m. And information and ways in which you can link to those trainings will be sent to all those who registered for this training session following tonight's presentation. So a little bit about Deep South Center for Environmental Justice. We were founded in 1992 by Dr. Beverly Wright here in New Orleans, Louisiana, for the purpose of empowering African-American communities with research and information to make the case for change to achieve environmental justice. That work has since expanded to the entire Gulf region after Hurricane Katrina, where we're now partnering with community organizations, Unity in the Family Ministry in Pensacola, Florida, Chess Community Incorporated in Africatown in the city of Mobile, Alabama, ECHO, which serves a number of communities in the North Gulfport area in Mississippi. Here in New Orleans, communities in New Orleans East and the Lower Ninth Ward, served by Center for Sustainable Engagement Development, as well as Deep South Center for Environmental Justice. And in Texas, Houston, the community-based organization, it's called Achieving Community Tasks Successfully, and the Coalition of Community Organizations. So we're glad to have all of those organizations as co-sponsors for these trainings. Next, I also want to thank Deep South Center for Environmental Justice technical staff led by Kim Dunn and Bruce McClue, who are part of this training, and will be you'll be hearing from them in the breakout sessions that follow, that will take place during this training session. With no further ado, I'm going to turn it over to our trainer for the day, Ms. Michelle Dawkins.
Good evening, and thank you for joining us. We look forward to you gaining some information and hopefully implementing this information as soon as you get it, because there's a lot going on and we all know that. So we want to make sure that we share this information with whomever that we can. So a little bit about myself. My name is Michelle Dawkins. I'm an occupational safety and health trainer and consultant. My background is that I do HAZWOPER and DOT training, that's hazardous waste operations and emergency response. And as a matter of fact, I'm down in Savannah, Georgia right now, completing one of our classes now. Also disaster preparedness training, workplace health and safety, consumer safety awareness. And my background is actually as a microbiologist. So all of this falls right into my wheelbarrow, right? All of the things that we're dealing with right now falls into my wheelhouse. And so I'm really pleased to be able to present this information and hopefully, you know, enlighten you in the areas that you need so that we can finally come up with a way of making sure that we are safe. You know, there's a lot going on. This thing is not getting any better. And so we want to get this information out to you so that we can do that. So the Deep South is not responsible for any of the outcomes. This is just information that we hope that, you know, you will share. There's been assessments that have been conducted in the field. And so this information is really designed to assist you along the way. And we don't want to be held accountable for anybody that mishandles the information. So this training is being recorded. So a little bit of logistics or housekeeping. Your microphone and your video will be disabled so that everyone can view the presentation. We want to make sure that we're able to sustain the proper bandwidth as we proceed through the training. There will be an opportunity throughout this process that if you have any questions, please take the time to utilize the chat box, which is portrayed here on your screen. Go ahead and jot down those questions, any questions that you may have. As I said, at the end of the training, you'll have an opportunity through our Q&A section to ask those questions. We also have some breakout sessions throughout the training, and we hope that you will be an active participant during that time. You will also, after this training completes, you'll have an opportunity to complete a survey. We would like to get your feedback so that we know what we can implement maybe in the next training, anything that you feel that we may be able to add. So thank you, and we hope that you enjoy the session today. So before we begin, we're going to do a pre-training poll. We want to see how much you actually know about COVID-19, what you know about this coronavirus. So we're going to take a quick five question quiz. We want you all to participate. Make sure that you scroll all the way to the bottom so that you can answer those questions, and we'll take a look at it at the end of the session. So here is the polling questions. Here are the polling questions. So please click your answer and don't forget to scroll down because there are 5 questions total. And once you hit submit, it will be submitted and your screen will clear so that we can proceed ahead. Maybe one more minute. And Ms. Williams, when you're ready, we can proceed. Okay, and we'll take a look at those polling questions toward the end. So the purpose of this training is to increase your health and safety awareness as to the spread of COVID-19. As I said, there's a lot of information out here, and people are really confused because in one instance, we're hearing one thing and we're hearing something else. So we hope that you gain a heightened awareness of the virus and how communities are being affected, a better understanding as to its mode of transmission. How is this disease being transmitted? Also, we hope that you would get some basic mitigation strategies and a better understanding on how to protect yourself, why the protective items that have been recommended are recommended, and what you need to do in terms of protecting yourself with these items. So let's take a look at how one household deals with an infectious disease. Oops, apologize.
You take that thing off. Take off that stupid mask. Now, I'm just trying to protect myself. Ridiculous. What is this? What's what? Tape on the knife and the fork. Get them mixed up. Got a label on all your stuff. All the stuff you eat with got a label on it. Don't label on everything. See, F is for Fred, and yours is marked C. C? Yeah, contaminated. You want me to go sleep in the yard in the back of the truck? I don't think we have a cord long enough on the heater. You said you gonna ask me what the tape on the knife on the floor. I can't you said you needed your rest. Man, stop getting excited. Sit down, relax. Guess you're right. I'm not supposed to time myself out. Hey, Pop. My cheeks look flushed. Cheeks look flushed. It's hard to tell. I know you got your mother's skin. You look all right to me. And you don't get dressed and going out to work. Go to work? Pop, I got TB. I can't go to work. I'm sick. Well, I thought the fresh air might do you some good. You thought you'd get me out of here so you could have this house fumigated. How much do they charge? Yeah, well, I'm not going to work. So I got to go down to the hospital and get my new x-rays. I want to get this house fumigated. Go to work and I'm sick with TB. Say, Pop, did you put this in the safe for me? What is it? It's my will. You're going to have a will made for? You said yourself, they cured that stuff in a few days now, real fast. Yeah, but you never know. Yeah, okay. Well, I got to be going. I got to be to the hospital in an hour. I got my shaving stuff and my pajamas in here. I suppose they'll take me right to the sanitarium. So long, Pop. Well, so long, son. And I come to visit you if it ain't too far. That'd be real nice, Pop. Well, adios, old fella. Hello, Joy. Take care of yourself here.
As you can see, we've been dealing with infectious diseases for a long time. And although that's the comical side of it, right now, it's not so comical because we're actually losing a lot of people. And so what exactly is a pandemic? There's elements that must exist for a pandemic to be declared. First and foremost, it has to be new, a novel. We heard in the very beginning they were calling it a novel virus. That just simply means it's new. So that means that it's not been previously circulating in the population. And no one in that population is actually immune from that particular virus. Also, it has to be sustained. A community spread has to be sustained, meaning that it spread from person to person. It's not necessarily associated with travelers entering from the source country. And then lastly, it has to have worldwide distribution. And we saw back in March of the beginning of this year that that's exactly what happened, that it started spreading, or at least we started learning of its spread worldwide. So it met all of the criteria and it was deemed by the World Health Organization as a pandemic back in March of 2020. So where did the name come from? COVID-19 is a respiratory disease. The name is simply an abbreviation. The CO stands for corona, and that's Latin for the word crown because of the way it looks underneath the microscope. It has like spikes around the surface of the virus, like a crown. The Vi is for virus, D for disease, and 19 simply is the year that the viral disease was actually identified, when it was first identified. So we do need to understand that the virus that causes COVID is referred to as SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome, Coronavirus 2, because we have had other, we had another SARS-CoV-1, but this one is CoV-2. And as I said, it is a novel virus. Some of the major symptoms include fever, cough, and trouble breathing. But we've now since learned that there are a lot of additional symptoms, things like shortness of breath. Well, that's trouble breathing, but people have been complaining of muscles, problems with their muscles. My oldest brother was diagnosed. He started having chest pains. There's been indications of people now having problems with their internal organs. So there's a lot of different symptoms because once again, this thing, we're learning more and more about it every day. The average incubation period is roughly around 5.2 days. And most people 99% of the people exhibit some sort of symptoms between that 12 to 14 day period. And this is why they ask people to isolate themselves as well for that length of time. There are also people who are infected with COVID-19 who don't necessarily require hospitalization for respiratory disease. And there are some people, remember, who are not showing any signs. They are asymptomatic, so there's no signs. And right now, researchers have said nearly 80% of the people are showing no signs. So that means that only 20% of the population actually show signs for this particular virus. Why is that important? Because we're walking around or we're coming into contact with people all the time, and there's really not a way for us to know when we have that large number of people that are asymptomatic. We have no way of knowing whether or not they actually have the disease. So there's a family, as I said, a family of known coronaviruses. There's 7 in total. And so we started out with these back in 1999, and then we've identified the first the first SARS-CoV-1 actually was back in 2003. We went from there to the MERS in 2012, and remember that one was designated as the Middle Eastern Respiratory Syndrome. And now here we are in 2019 with SARS-CoV-2, which is what causes the COVID-19 disease. So we've seen they have some similarities, but this particular virus seems to be displaying some other symptoms and some other activities that the previous viruses have not. So what are some of the sources of infection? That right now, what we know is that droplets are one of the major sources of infections. And droplets are produced when a person coughs, if they sneeze or speak forcefully, if they sing. They've also been saying that when people work out in the gyms, that's another time where people are able to produce these large droplets or small droplets. And so you have a demonstration there on what these infectious droplets look like. The droplets from an infected person's respiratory tract can travel to the mucosal surfaces. Those are your moist areas of your body, like your eyes, your nose, and they can travel to somebody who's near you. That's why they recommend wearing the mask. And it's most advantageous if both individuals, or if, more than, if you're in a group, if everyone has on that mask, so that we're making sure that those droplets aren't being transferred. The infection from the droplets can occur between people when you are less than that 6 feet apart. So we want to just emphasize those things, and these are the things that people seem to not be doing. These are the easiest ways to make sure that you're protecting yourself. And as I said, that's a pretty good graphic that gives you a good idea of what it looks like, what those droplets look like. So another source of infection is surface or objects. Person can become infected by touching his or her hands on a surface or an object that has recently been contaminated with SARS-CoV-2, and then touching those mucosal areas that we mentioned earlier with those same hands. So you want to make sure that you are disinfecting surfaces. We're going to talk about that momentarily. The other source of infection is the fine fluid particles. And most times when we talk about the fine fluid particles, as demonstrated in this particular picture, as a person sneezes or coughs, though we're allowing the particles from our mouth to come out, and they come out aerosolized, so they're airborne. And there's indications that those types of aerosolized particles can stay in the air for hours, for 3 to 4 hours, and they travel over a longer distance than droplets. So we want to be careful with everything that we do, but also be cognizant that when you are doing different activities, that's a possibility. So airborne close contact, when you come into close contact in closed environments, involving high concentrations of aerosols over a long period of time, you want to make sure that you're taking all the safety precautions. As I said that I'm staying in a hotel right now, I've been very, very careful. I've not been using the elevator. I've been walking the stairwells. It's not a crowded place, but I'm still making sure that I'm washing my hands frequently. I'm wearing my mask. Even when I'm teaching the class, I'm wearing my mask because I want to make sure that I am, taking all the necessary precautions for those that are around me. I'm normally up and walking around in the classroom. I'm sitting behind a desk, which is kind of hard for me, sitting behind a desk, but I'm making sure that the students they're all separated, and we are exercising all of these things, all of the guidelines that have been put forth by the CDC. So how long can viruses remain on surfaces? The studies have shown that for up to 3 hours in an aerosolized state or in the air, that's how long that it can stay in the air. Up to 4 hours on copper, 24 hours on cardboard, and then 2 to 3 days on plastic and steel surfaces. So this is important because I've heard people say, well, when I get packages from Amazon or any of these things, just understand that, there is a possibility that something can be on there. But, if you're opening that package and making sure that you're putting that packaging aside, then there should not be any problems, but you're still washing your hands. You can actually spray down that package. There's things that you can do to make sure that you're safeguarding yourself and your family. So what is our goal? Our goal, of course, is to stop the spread. And we can only do that when we exercise the defense mechanisms, making sure that we're staying separated from uninfected individuals, making sure that, you understand, first of all, how this disease is being spread, and then you start putting those practices into play in your environment, your household, your church, your workplace, whatever it is, it's up to you to have these mitigation strategies and thinking these strategies through. And like I said, we're hearing a lot, and I heard one of my colleagues say on yesterday or 2 days ago, that just because these facilities now are open, it doesn't mean that this thing is over. And now we're seeing that. I was looking at the news tonight and looking at the number of states that are now, their numbers are doubling and tripling. So we have to make sure that we're exercising our defensive mechanisms. Some other community mitigation strategies include physical distancing. We talk a lot about that, but it has to take, people have to actually activate that. They have to be doing these. Also the personal protective measures, and then cleaning and disinfecting surfaces and objects. And these exercises have to be done consistently. We can't just do it some of the time. We have to be doing these things on a consistent basis. It is now a part of our new norm right now. And even though we get tired of it, you know what? I like living. So I'm gonna have to, I have to tell myself I gotta do what I have to do so that I can keep living and living a healthy life too. So right now we're getting ready to go into our first breakout group. And you're gonna automatically be assigned to a group. You're gonna look for your name and a room number. And you're going to click that name and you're gonna join that small group. You're gonna have 10 minutes for your discussion. If you can, we want you to take a photo of the questions so that you can remember what those questions are when you go into your breakout rooms. And while you're in there, if you can, immediately pick someone in your group who's going to be a report, who's going to do the report back once we get back into this main room here. You're going to have 10 minutes. Once those 10 minutes are up, you're going to automatically be redirected back to the main area. Okay, so here are the questions. First question, do you think information from the news and other sources about stopping the spread of COVID-19 is confusing or conflicting? Second question, where do you get information about COVID-19? And then third, what are some of the things happening in your community to stop the spread? So if you have a few minutes, click a picture, or if you can take notes really quick, go ahead, because you're going to automatically be sent into one of our breakout sessions. And we want you to have really engaging conversation while you're in there. Remember, you only have 10 minutes, so let's get to it.
Hey, Mr. Peter. Michelle, in our breakout section number 4, Mr. Stacy Porter is going to be the lead person.
Okay.
Hi, go ahead, Stacy. Can you hear
All
me?
right. Yes, I have it. I had to take it off mute, so you have that little delay. With the first question, we discussed, and team, jump in definitely if I missed something. The first question that we discussed, apologize, I'm drawing a blank again. As far as the news, I'm sorry. Now, one of the things we talked about, it is conflicting information, because when you talk about the contact tracing and testing, you know, we're hearing from IQ 45 on this is what we can do, but then we're hearing from the doctors and the scientists that no, that's not the case. So there's a lot of conflicting. I know I mentioned that I don't watch the news. I just don't do it because, again, the news is their opinions and is not the news. And one of the things I always talk about when it comes to Fox News, you know, I always say Fox News is a verb, is baffle or deceiving. So that's how I treat Fox News. And I can't speak for the other medias, but we did talk about it being conflicting information when it comes to watching the news about this pandemic. Team, did I miss anything on that one?
No, you didn't. And we just the other question was, where do you get your information, and what are some things being done in your community to prevent the spread?
And okay, as far as the information where we're getting that, we did talk briefly about the CDC, which we know the information on the CDC is continuously changing as well. So even though we're having this discussion right now, we can go onto the CDC website an hour, 2 hours later, and that information has changed. However, it's still a reputable site, so we have to continue to listen and follow that, and just have to practice our patience. Another great website, and I didn't mention this with the group, is the John Hopkins. They have a terrific website that gives you up-to-date information. I want to say Ms. Dawkins may have that information as well. She may be able to share with the Zoom team on this call. And the last question that we talked about as far as what the community is doing, all of us felt like we are doing our part as far as washing of the hands for the 20 seconds increments, of course, with the soap and water. And of course, the sanitizer, as my kids would call it, sanitizer. You know, that's a last resort. You know, I keep that in my vehicle because I may not be able to get to soap and water right away. You know, we talked about the practicing of masks and as well as the social distancing, which is all fine and great. But, you know, once we get out into the public environment, you know, your stores, or if you're going to pick up food, things like that, I can't speak for what others are doing. And that's why we're continuously seeing the spike in our numbers, because although, you know, everyone on this Zoom meeting may be doing what they're supposed to be doing, but you may have another 20 that's not doing that. And I know they're saying that outside environments, you know, try to keep activity as small as possible. But the best fit for that, of course, would be the outdoor activities versus your indoor activities, which we saw, you know, the past 2 weeks in Arizona as well as Tulsa. Even though those numbers aren't out yet, but I'm sure we all saw in the news or on the internet that all those folks standing in line going into the venue, none of them had on masks or any type of protection. So that's one of the things that we discussed in our team is the washing of hands, the face mask, and the social distancing. If we can only present that information to everyone. And we also brought up being a recommendation. Even though nothing is mandated, you're going to always have folks, you know, fighting that. But as Mr. Bruce said in the team, you know, if you're going to require me to come into your establishment with a shirt on, that should be the same requirement for me to wear a mask. You cannot come into my establishment without a mask. One of the things I also talk about when it comes to the airline industry, we are required to wear a seatbelt during takeoff. So let's treat the face mask the same way. And that's pretty much the gist of, I'll call us Team One since we're number one.
Yeah, we'll bring us. Yeah, T1.
Yeah.
Also, I want to bring up. I want to bring up that let us not get confused and let us not get relaxed when it comes to large family gatherings, because I know a lot of people do family reunions in the summertime. There is an article about a family in Texas. They were at a large family gathering, and 18 of them tested positive after the gathering, and 3 of them were critically in the hospital. So just because you're in the same family and does not mean that you are safe. It's still large gatherings of people, even if you're having a family reunion, a family barbecue, those things can be a hub or an incubator for the virus.
Now, one thing I'll add, and I apologize with our group, we also had a chemist in our group, and I didn't know if you wanted to add anything if I missed out on something.
Actually, had a couple of chemists.
Okay, if not,
Yeah, go ahead on, Michelle. That was Kim.
we're going to go ahead and proceed with the next group. I believe Mr. Peter.
Yes, ma'am. So some of my thoughts on the virus is that there's a lot of conflicting information out there. Like I was in college for a while with this virus. I actually did a lot of research on different. First of all, the news, the CNN and Fox and MSNBC, all the local news I looked at, and there was so much conflicting information that I had to do my own individual research. And so with that, I had to go to sites, to websites that were not popular, but had viable information from scientists who were actually working on the virus, who talked about viruses, who talked about immunology and virology. And as a result, in 3 months, I've gained a lot of knowledge on what a virus is and how it's passed on, and how hard it's to pass on, and how it can also be targeted for certain ethnicities. So with that, my assessment of it is to make sure that the body maintains a very good immune system. That's the main thing. As you know, no disease can penetrate a body that's well maintained. That's the first thing. The other thing is to try to alleviate some of the fear that the virus itself, or the information on the virus, has passed on to a lot of our people, especially our seniors, who have taken it to heart to the point where they do not even leave their homes. They don't. They're cut off from their families because they tell their families don't visit them. Some of them would go so far as to move their curtains to talk to family who are outside in their car, but they won't speak to them. They're in their house wearing masks, and they're actually dying in their homes. I take my granddaughter out every day, if possible. We go to the park. We don't wear masks, but we social distance from people because of we want to honor their whatever they believe in. This one lady called me a murderer because I'm doing that, but I don't think a lot of people are actually giving the proper information, and as a result, they have created this fear that's doing most of the killing, especially of the senior citizens. Another thing that I have read is that a lot of the information that we are getting from the main source of information are intended to ramp up this fear in people. You know, there are 2 things that I see that want to come out as a result of all this, of the what I call a pandemic that's going on right now. 1 is to introduce a vaccine, and 2 is to deal with the currency situation. So we'll deal with the vaccine at this point.
Vaccine. Peter, can you hear me?
Yes, ma'am.
Hi. I'm not quite sure. What we're trying to do right now is have report backs from small breakout sessions.
Yes,
Were you in a breakout group?
I
Yes,
was
he
previously.
was.
Okay. All right. So there are 3 questions that we're trying to get answered and just get folks' thoughts on. I hear where you're going, but it's just in terms of just trying to stay with the flow of this training session where groups had met and talked about what they think about information that they're getting about the pandemic. Is it conflicting or confusing? What's happening in their communities to stop the spread, if anything? And then another one is where do they go for their information sources? So we're hearing from you about where you're going for your information sources and how you're analyzing and digesting that. And I appreciate you sharing that, but I think just in terms of the interest of time, we need to create some space to go to some other report backs because we have 2 more groups to report.
Yes.
Okay.
All
So
right,
there's
well,
breakout session 2. That's the group that I was part of. And Joycelyn Davis is the reporter. If Joycelyn can.
well, do you want me to stop there or?
That would be, yeah, I'm asking if you could just because of the time frame we've got.
Okay, all right, no
Thank
problem.
you.
So who's reporting, Monique? Ms.
Yes,
Johnson?
Joycelyn Davis on. Yep, she's unmuting herself.
Okay. But the first question in our group we talked about is the information confusing or conflicting. It's conflicting because of what the president, the information that he's giving. Sometimes some people look to your leader for information, and he's not giving the correct information. So the information is a bit conflicting. And where do we get our information about COVID-19? Here in Mobile, there with the Mobile County Health Department, there's a briefing every day at 4 o'clock on the news where the doctors give us information of the new cases and the numbers that are coming in. So that's where we get our information from. And what are some things that are happening in your community to help stop the spread? Well, we talked about going into grocery stores and different places like that. And you have some people wearing the mask, and it's kind of like a 50-50 thing. I like to go shopping at Sam's, and at one point you can only have a few people to come in at a certain time, but now they just let everything open up. So it's like a 50-50 as far as people wearing masks and social distancing here in Mobile.
Okay. Thank you, Ms. Davis. And the last group, I'm not sure who was represented in that one.
3, we have Brittany is representing group 3.
Thank you, Deb.
Okay, so our first question, the information from the news confusing or conflicting? I believe it is confusing because, I was saying in the beginning, it went from, people in March, I believe people were saying like, you don't need a mask if you're not a healthcare worker or if you're not infected. Then it went to either wear, you could wear the cloth mask or you could wear a actual medical mask. And now so point it's like everyone needs to wear a mask. So, in the beginning it was it still is conflicted, but in the beginning, that's one thing that stood out that was really confusing. And just all the different, I guess with it being a new thing, a novel virus, everybody doesn't know the facts. And as you stated earlier in the meeting, that things they're still trying to figure out things with that. So just the whole virus within itself is pretty confusing, and information that we get is conflicting. I get information from mostly CNN, and also I see things on like Instagram and Facebook, but for the most part, CNN. And then the last question was, what do I see around my community? I live in a suburb of Dallas. So what I've seen here when they first opened up, some places require masks and some didn't. That was, you know, a few weeks ago, but just the other day I visited a store which was Home Goods, and another like fast food restaurant, which was Panda Express, and they are requiring people to come in with the mask. Grocery stores like Kroger that I go to frequently, they aren't really requiring, you know, people to wear masks. Some people do, some people don't. Like, you know, the last person stated, it's like a 50-50 thing. So I guess everybody's just, you know, trying to see, you know, just playing, kind of just gambling and seeing how it goes. And that's it for me.
Okay, thank you so
Yeah.
much.
No problem.
Thank you. And so as you can see, we're a very divided nation. We're no longer the United States, we're the divided states. And that is really costing us. It's costing us a lot of lives, and we have to get back to doing what we know we should be doing, even, you know, especially in our communities. So thank you all for participating, and we hope that as we proceed in the training, that you'll gain extra information. So can you all see the slides again?
Not right now.
Uh-oh, okay. Toya, DJ. 1 second, let me try to get these back on here. Okay, 1 second, it's coming. I don't know why this computer. Okay, are you able to see it now?
There it
Yes.
is.
Thank you. It's a little different being in a hotel depending on their internet and stuff. All right, so what's wrong with these pictures here? If you can see with this person, they have safety glasses, they have on their PPEs, but one of the things when you're wearing your personal protective equipment, he has on gloves. One of the things that he's most likely doing is he's cross-contaminating as he's, you know, touching his goggles that are on his face. One of the areas, remember we said that you want to be cognizant of touching your face and your eyes, those areas where you have the soft tissues or your mucosal tissues. So that's one of the things. And with the taxi driver in the second picture, this guy has on gloves. Chances are he's been wearing those all day. So no telling what he's touched along the way. And so once again, cross-contamination is most likely a probability with him. And that with the officer, you know, he has on a face mask or face mask. And one of the things, if you notice his face mask, there's openings. It opens widely on the side. And this guy is most likely coming into contact with people, you know, up close and personal. He has on no gloves. So he's still very much at risk. And we're going to talk about some of those things as we proceed and going on. With this particular pictures, with these pictures, we do see the social distancing in the very top portion. We see in the second picture, we see individuals, this worker, she's bagging up groceries with gloves on, but how often is she actually changing those gloves? You know, that would be one of the questions that I have. How often, if she's going from customer to customer, is there an opportunity for her to, you know, come into contact with something and then spread it? I think so. And then with this third person, or this third picture, this individual was at work. He does have on PPEs, but he's taking the opportunity to take a selfie. And so, you know, the fact that you're utilizing your phone, you're touching it, even though you have gloves on, the chances of that thing being contaminated is great. As I stated earlier, that my oldest brother came down with COVID, and my sister reminded me that a day or two earlier, he had sent us a selfie while he was at work. Well, he works in a laboratory. And so that's chances are that might be how he caught it. So, you know, understanding that if you can, try not to bring your phone around when you're going into stores or whatever it is you're doing, because the likelihood of your touching that phone is probably great when it rings or somebody texts you. So you want to be very, very cognizant of all of the activities that you're doing with your hands, whether they're gloved or ungloved. So physical distancing, we want to make sure that if you're sick, that you do stay home. I have a friend that was doing Instacarting, and she got sick. And about 2 days later, after she felt well, she started working again. And I told her, you know, that was wrong in many ways. You know, first of all, you needed to give your body a chance to bounce back, you know, to gain, you know, get better. But then also now you're still putting other people at risk. You want to consider a grocery delivery service if possible, or mail order your medications if possible. Avoid using public transportation if you can. Also, a lot of people are dependent upon rideshare, but what are you doing, and are they exercising precautions? So you want to make sure that that's a probability. You have a right to ask them to keep the windows, you know, to roll down the windows a little so that you have some cross ventilation. All of those things are, you know, you kind of almost got to strategize now when you do leave your home. Make sure that you are physically distancing yourself. And then try not to gather in large places. I think Bruce made a very, very good point when he talked about the fact that, you know, it's summertime and, you know, a lot of us haven't been around our families. And so we figure, well, we're just going around family, but if we're still in large groups, then the probability of us, you know, somebody becoming contaminated or, you know, becoming infected grows as, you know, those numbers grow. Make sure that you're still avoiding shaking hands and hugging people in public. And then a lot of our public facilities have directions, walking directions in the store. So make sure you're adhering to those things. These things are done so that you can remain safe. We didn't like seatbelts when they started. Many people didn't like seatbelts. I won't say that I didn't, but many people didn't like seatbelts when they started making you wear them, but we recognize that the accident rates are decreased when you do that. This stuff is no different. It is something new, but we can acclimate to it. So we want to make sure that we're adhering to those. Some of the other personal protective measures, of course, we keep mentioning it, and we have to keep mentioning this stuff. Avoid touching your nose, your mouth, and your eyes. Utilize cough etiquette. That's one that really gets to me. Utilize cough etiquette, because I was in a grocery store the other day and this lady coughed and she did not have a mask on, you know, and so stuff like that's one of my pet peeves already. COVID or not COVID, I just can't stand that. Or blowing your nose out in public where, you know, it can affect other people. Wash your hands with soap and water. And we're gonna demonstrate that momentarily, making sure that, you know, you're touching all of those areas underneath your nails, utilizing hand sanitizer. Now there's a lot of public service announcements out about hand sanitizers because children are getting into it and getting sick. And now they're finding that there was a report that just came out this week talking about a lot of the different sanitizers are actually toxic. So I am a firm advocate that if you can access soap and water, utilize that first. And as one of the speakers, I think it was Stacy, said earlier, when you don't have access to soap and water, then that's when you want to utilize your hand sanitizer. And then, of course, wearing your face coverings properly. Some other protective measures, if you can, leave doors to rooms open so that people don't have to touch the door handles. Wipe surfaces such as your carts and baskets. Many of the stores are doing that currently. I went to Aldi actually since I've been down here, and they had a person outside that was wiping down the carts before you went in. I didn't really need a cart, but she was wiping them down. Do not put on gloves to create a barrier or, you know, touch many things and leave them on, because once again, that probability of cross-contamination grows. And do not keep and reuse your contaminated gloves and face masks. If you're wearing the cloth face mask, you should be washing those on a regular basis, sanitizing those. And of course, with your gloves, you don't want to reuse those. You want to dispose of them properly. So let's talk about wearing gloves. Let's take a look That's
There's
it.
no point in wearing gloves if you're not gonna wash your hands every time you touch something. Okay, so I wanted to get on here and do a quick little thing here. Seeing a lot of people out in public wearing gloves right now. That's great. If you want to wear gloves, you know, that's all fine and well. You absolutely can. But I want to remind you of a little thing called cross-contamination. So let's say I'm in my car, I'm at Meijer, I'm getting ready to go into the store, so I put my gloves on, right? And then I grab my phone. For this purpose, this little piece of cardboard here is going to be my cell phone. Now I go into Meijer, walking around, I got my phone, maybe it's in my pocket, or maybe it's on the cart, okay? And I grabbed my wipes and I cleaned off my cart and I cleaned everything off, but you know, I still have my gloves on. So here now I'm in Meijer, I'm getting my groceries, and I reach for something, and you know, let's just say I reach for toilet paper, right? If you can find any, for toilet paper. Well, take my toilet paper and I put it in my cart, and now if you can see, I have all these germs on my hands from my toilet paper, but it's in my cart, but it's on my gloves, that's fine, right? It's on my gloves. Well, you know, but now I'm walking along and my phone rings. So I've now touched my hands together a couple of times, and I reach for my phone, and I have a text message from my husband telling me to get more chicken. We need chicken tonight for dinner. So let me text him back. Okay, honey, I got it. I'll get us some chicken. Okay, so I put my phone back in my cart. I continue reaching for things, continue getting groceries, and then, you know, I just keep touching everything. Oh, my nose itches here. Let me itch my nose. Okay, oh, now my phone's ringing. It's my mom. She needs me to get her something. Hi, hello, hi, Mom. What can I do for you? Oh, hi. Oh, my goodness, look at those bacteria. Oh, but now it's okay. It's totally fine because I'm wearing my gloves. I have my gloves on. I'm so safe in my gloves, right? And, you know, I'm done. I paid. I'm at the grocery store. I'm all done. I paid. My phone's back in my pocket. I get to my car. I reach for my car door handle. And then I'm all done with these gloves. And I don't want these dirty gloves in my car, right? So what should I do with my gloves? Oh, let's see. You take them off appropriately, and they belong in the trash. In the trash can, people. Instead of putting them in the parking lot next to your vehicle, please put them in the trash. So your gloves are off, your hands are clean, you're in your car, you're safe, right? But oh, your phone rings again. Oh no, let me pick up my phone here. Oh, hello. Look, this is called cross-contamination. There's no point in wearing gloves if you're not gonna wash your hands every time you touch something. There's no point, friends. So do whatever makes you feel safe, but remember, there is some science here. And all this fear is just manifesting people into being crazy and just not acting very smart. So one, go ahead, wear your gloves, but you need to clean your hands all the time. Don't touch your face. Don't touch your dirty phone. Look at this dirty, disgusting phone that got all over my face. Secondly, throw your gloves in the trash. They do not belong in the parking lot on the ground. All right, I'm done. I'm done with my craziness. Bye.
Look at back then, we were at what, 300,000 cases, and today we're at over 1 million, right? So those numbers have grown tremendously. So here's another one. We're talking about this virus. So a virus versus a germ versus germs. Unlike a germ, a virus needs a host to live and has a weak membrane. The corona membrane can be broken down with simple soap and water. Watch this.
You know that the best way to prevent the spread of coronavirus is to wash your hands. Wash your hands! But why? It's because soap, regular soap, fancy honeysuckle soap, artisan peppermint soap, just any soap absolutely annihilates viruses like the coronavirus. Here's how. This is what a virus like coronavirus looks like. It's a bit of material surrounded by a coating of proteins and fat. Viruses easily stick to places like your hands, But when you rinse your hands with just water, it rushes right over the virus. That's because that layer of fat makes the virus behave kind of like a drop of oil. You can see it happening in this demonstration. Oils are just liquid fats. What happens when you pour oil into water? It floats. It doesn't mix. But add soap, and suddenly that fatty oil dissolves into the water. That's because inside, soap has two-sided molecules. One end of the molecule is attracted to water, the other end to fat. So when the soap molecules come in contact with water and fat, these dual attractions literally pull the fat apart, surrounding the oil particles and dispersing them through the water. Let's go back to our coronavirus molecule with that layer of fat holding everything together. When it interacts with soap, bam, that fat gets pulled out by the soap. Soap literally pulls apart and demolishes these viruses. And then the water rinses the harmless leftover shards of virus down the drain. But, and you know where I'm going with this, it takes time for this effect to happen, 20 seconds to be specific. To show why, we ordered this lotion that mimics viruses in their fatty layers. It glows under a UV light. If you just rinse your hands under regular water, nothing comes off. If you wash with soap for just 5 seconds or 10 seconds, your hands are still covered. The virus is still there, able to get you and others sick. But 20 full seconds, now the soap is actually destroying the virus. Hand sanitizer works too because it's mostly alcohol, and alcohol works in a somewhat similar way to soap, breaking down that fatty layer. You need a high concentration of alcohol to make that work. The CDC recommends hand sanitizers with at least 60% alcohol. But even with 60% alcohol, the CDC recommends using soap if you can. If your hands are sweaty or dirty when you use the sanitizer, that can dilute it and diminish its effectiveness. As for soap, just any old soap works. You don't need soap marketed as antibacterial even. The FDA says skip it. There's no proof it's any more effective. Just be sure to wash your hands for 20 seconds. That's happy birthday twice. Happy birthday, dear, I guess me. Or the chorus to Lizzo's Truth Hurts. Straight to my face. Or Prince. Or Eminem. Go, go, or even Dolly. Jolly. Just as long as it's 20 seconds. And you're using the ultimate virus annihilator. So,
whatever song you choose, I like to use Montel Jordan's This Is How We Do It. Whatever gets you to utilize that 20 seconds, that's what we need to be doing. I hope both of those videos have, made an impression on you, and that you will go ahead and do the right thing when it comes time for washing your hands, and your choice of wearing gloves versus not has been also chosen. Okay. So in addition to, the washing your hands, which we know now is very, very important, making sure that you wash your hands for that 20 seconds, not that 5, not the 10, and not just rinsing them, but you're actually utilizing that process for 20 seconds to kill this particular virus. We, once again, want to make sure you do that, but also the decontamination of surfaces and objects is another important area. We want to make sure that you minimize whatever it is that, you come into contact with or have the probability of coming into contact with by doing the appropriate type of cleaning. And as of March 19th, the EPA came out with 287 available products, including household products that have been registered to kill the COVID-19 virus. And many of them contain ethanol, the 70% ethanol, or the 50% isopropyl alcohol, as we just saw in that particular video. So we want to make sure that you're doing that appropriately. This particular depiction right here shows a good demonstration as to what it looks like when we wear masks. So the first picture on the top, you see the highest risk is when neither individual that's standing there with it, you know, they're not that 6 foot distance, and neither one of them are wearing masks. The other one shows how the probability goes down a little bit as one person has on masks and the other one does not. And then what happens when you have both individuals, you have an even more protective environment now. And then when you have the 6 foot distance, this one is what it looks like. So you have the 6 foot distance and both individuals wearing masks. So the probability goes down a lot lower. So we want to make sure that we're keeping these pictures in our mind when we decide not to wear a mask, or, you know, or the other way around. So we hope that that's getting to you. There's been quite a bit of questions as to whether the handmade face cloths are effective, and it has been shown that they are effective. And we just saw why in that graphic that we just had. You want to make sure that you are wearing something so that you are protecting. Remember, the mask does not protect you, but it protects the other person. So it works better if all parties involved are both, you know, are all wearing those masks. So you want to make sure that, you know, if you have the means to get those handmade masks, you know, whichever mask that you choose to use, you want to have something on your face. And several states now are going back to mandating that everyone wears a mask. And they're doing that because, of course, now they see the numbers going back up. After now they've opened up their states, they're seeing the, you know, the fact that, hey, we may need to put some of these safety precautions back in place. And hopefully many of you have not stopped utilizing your mask when you go out. These are surgical masks. They are not respirators. They are something that you can use, but they are not respirators. These are the different type of respirators. This is what most of our healthcare professionals use and need, and this is what we were in lack of in the very beginning of, you know, this process. And hopefully now all of our hospital personnel have these, especially now that the numbers are going back up and the hospitalization numbers are going back up, because we have lost a tremendous number of our healthcare personnel, from nurses, doctors, and other individuals in between that are working in our hospitals, because they didn't have access to adequate respirators. And of course, when you're doing frontline work with people who are knowingly sick, they're the ones who need this type of equipment. All of these respirators that we see here, individuals have to be tested for. There's a process that you have to go through in order to effectively wear these respirators. And they're really designed for individuals that are working in specific areas. But the face mask will suffice at this point in time for, you know, us doing the basic things that we do around our community. We also have to remember that we're still in the midst of a pandemic. And I'm convinced that the numbers that we're seeing now and the rise in the numbers is a direct result of what we were seeing last week and the week before. And so now these numbers, we know 14 days later, here we are. And somebody mentioned it earlier, you know, in Tulsa and some of the other places that there's been some other types of activities going on. We're going to see those numbers start to increase as well, because as you can see in many of these both of these pictures here, there were a lot of people that were in very, very close proximity and they did not have on masks. And so now they're saying that the numbers now for the individuals between, I believe it's the ages of 19 and 30, I believe were the numbers I heard today. Those numbers are going up very, very rapidly. And so we want to make sure that we're also sharing that information with that particular age group, because remember in the beginning, we were emphasizing the elderly, but now we're seeing that thing change. So we want to make sure that this information is getting to people who really are being affected and who need to hear this. So right now we're about to enter into our last group, our breakout session for the day. It's the same process. You're going to be in here for 10 minutes. We want you to pick that person who can report back. And when you come back and report back, we only want some, you know, just the highlights for a couple of minutes for the sake of time. We want to be able to get all of the groups through the process so that we can, you know, have a chance to listen to everyone process this. And we understand that it is getting late in the evening, so we want to be cognizant and sensitive to time for people who've worked all day. So the question is, and there's only one question, is there something that you think you would do differently to protect yourself from COVID-19 based on all of the information that you've been able to gain from this training tonight? So that's your question. We're going to now go ahead and break out into our breakout sessions, and we look forward to hearing from you when you come back in 10 minutes.
Hi, Robert. Hi, Robert. Can you hear me?
dog is your best friend. But your dog's best friend is your ex-girlfriend because she always has irresistible pupperoni. Be your best friend's best friend. Pupperoni. Where can a healthier heart lead you? For people with heart failure taking Entresto, it may lead to a world of possibilities. Entresto helps improve your heart's ability to pump blood to the body. Don't take Entresto if pregnant. It can cause harm or death to an unborn baby. Don't take Entresto with an ACE inhibitor or Aliskiren, or if you've had angio.
Yeah, how you go?
Okay, so welcome back from our second breakout. If we could have group one report back, please.
I'm sorry, repeat that again.
We could have group one report back. I think that is you guys.
Yes, well, since we were all in the same group, if you guys don't mind, I'll go ahead and report instead of mixing it up. I'll just go ahead and talk about it. We just pretty much, in my group, I think a lot of us are already aware of what we're supposed to be doing. So, definitely the training is good and the training needs to be done on a regular basis because you have folks out there that need this training. But I think in our group, we were all aware about some things that we can do or we're already doing. I know in my case, I talked about, packages being delivered to my house, how I can do a better job with that. I know some folks, Miss Kim and Mr. Bruce talked about when they travel, not trying to knock anybody, for living in these locations, but they were just talking about traveling south from Mississippi, Alabama to Florida, I'm sorry, how so many people didn't have on face coverings. And that made her think, you know what, I wasn't really big into the sanitizer, but let me make sure I keep that with me. So just trying to be cognizant of things that we can do better in and around our house and when we go outside of our house.
Okay, thank you. Group two? Or just another group, whichever group wants to jump out there.
Hi, this is Bridget Murray speaking on behalf of one of the groups. We discussed quite a few things and very similar to the last group. We talked about surfaces as well and how to handle packages in the future. A lot of conversation regarding healthy lifestyles, diet, immune system issues, not to let your guard down. We talked about fear and how you should not allow fear to just lead your every step, but we should we should take precautions. And then the last thing we talked about was vigilance in research of the information, fact versus fiction, because we have so many different things being said, depending on if you're on social media, there are different things being reported. So you do need to be vigilant to review some of that information and research it for yourself, because there is a lot of false information out there. So that kind of, I think, listed all of the different things that we talked about.
Thank you much. Next group.
Wendy,
Yes,
you want to take it for our group? Not sure if she was having some mic problems.
Gwen, are you there? Okay. There's somebody else, Monique, in case Gwen can't.
Thelma's gonna do group 3.
Oh, I didn't know I was.
Yes.
Okay. Well, I've learned a lot and so much. I work with high school students with disabilities, and in the summer, I work with the city of Houston youth program, and they come to my office and work in the summer, and the city pays them to work. So I learned a lot about having them to wash their hands a little bit more and not wear the gloves, because they'd be touching so many things in the office. So I've learned that them using just the soap, I have a lot of soap in the office. Them just wash their hands a lot more when they're in the office, and make sure that they social distance 6 feet apart, and make sure that they wear their masks when they come. And also made sure that I spoke with all the mothers. I don't know what kids are going to be sending because we hadn't started the program yet, to make sure that they give me right that they have taken the kids' temperature, and they do have a right temperature when they come to the office. But that's something that I learned about contamination of the gloves, and I'm asking them, they don't want to, but I'm asking if they parents can, just for the 5 hours they're in the office, if they can keep their phones with them, and they can get their phone once they leave the office, because they touching so many things with that phone. So I learned a lot with that phone, because kids don't do anything but take selfies, and that's what happened. So that's what I learned. I mean, that was really, really beneficial for me to know this when I'm working with the youth.
Thank you so much.
Michelle, I'm sorry, but what the person who's going to be reporting back has dropped off. She was having trouble with her mic earlier. I don't know if someone from our group, Joycelyn or Joe, if y'all want to take it.
Can you hear me?
Yes.
Okay, I'll try here. I didn't take any notes. I know Gwen was having a problem with her mic, but that's something that you would do differently based on what we've learned. Well, this is what I reported in our group, was that I don't know if I would do anything differently thus far, but one thing that I know that I am going to do is stay on top of my nieces and nephews. They're part of the younger generation, and that younger generation just can't wait to get out there and socialize. And just like I used to do when I was back in my 20s and 30s, was I couldn't wait to get out there on the weekend and get in the club and just party up. And they do the same thing, but now it's a little bit differently. And I don't know how much the mask can protect you when you're inside a club, and you got a club that's designed to hold 200 people. You got 400 in there, but that's one thing that I'm going to do myself, to try to make sure that they adhere to some of the practices, because this thing is real. And like I also said, heaven forbid one of our big, strong athletes get it and died, and that would really put a damper on a lot of things. And I'm sure a lot of things will change if that eventually happens. But those are just some personal things that I talked about.
Okay, thank you so much. So was that all the groups there? I think so. Thank you all for your participation in our group sessions. We're going to go ahead and proceed on and head toward our close.
Who's on? Repeat that again.
And I go to the next one.
Hello?
Okay. So that right now, remember, all of this is important because there is no medication at this point for COVID-19. There are no proven medications to treat this particular virus. There's a lot of trials that are underway, but just like anything else, it's a process to get those things, get the medications and anything that's going to assist on that level into play. Also, there's vaccinations. We're hearing a lot of verbiage, a lot of stuff about vaccines. And even though number 45 keeps saying that, they're going to have a vaccine next month or in 3 months, it's a long process. In order for a vaccine to be, made readily available, there's a trial process, and you have to go through safety and efficacy, make sure it's efficient. And then you also have to do trials on a large population of people. So we're looking, normally it's in anywhere from 12 to 18 months. And remember, we're just not even 6 months into this thing yet, or we may be right at 6 months. So there's a long process ahead of time. The young lady that you see in the picture depicted is one of the lead doctors over at the CDC. And so, we're just waiting for that information and for that process to go through And, that's going to be up to people to determine whether or not, they feel that that's something that they can go through. So, a lot of things, that we weren't able to talk about tonight, like, making sure that you build up your immune system and having a plan. What happens if we do end up having to go back into isolation and quarantine? We want to start thinking like that. Okay, we want to have our strategy in place and, taking a look at, some of the things that we didn't know early on that we may know now, especially hopefully after this training. So mental health and stress is another big part of this. As the number of cases for COVID increase, so does the associated anxiety and stress. And, in talking to people, people are very stressed out. Mr. Peter talked about how some of our seniors have locked themselves into their homes and isolated. That is not good on their mental health or their physical body, because remember, our mental is attached to our physical, which is attached to our spiritual. So we want to make sure that we're taking care of our mental as well as our physical health. So there are some things that are in place for those who have access to smartphones, trying to stay connected to your family and friends. For our seniors who are locked in, I know for my mom and dad, we actually do duos now. We want to be able to put our eyes on them and see that they're okay. Because sometimes, our seniors are, some of our family members will say they're okay, but when you take a look at them, you see something differently. So you want to make sure that you're taking that time to check on your family members. Do things that you enjoy doing around the home, in your yard. Get out, get outside, but I'm saying, close to home, maybe walking around your neighborhood. And if you're around a crowd, then that's when you're going to wear your mask, right? Practice some stress relief exercises, whatever it is, whether it's gardening or doing some deep breathing, exercising, some things that you could actually do in and around your home, either, with your family members. Those types of things are what you want to do. People are normally, when people get anxious and overwhelmed, they tend to go towards the unhealthy behaviors, such as drinking and things like that. Well, we don't want that to happen. So we want people to, start to be able to do those things. We're seeing and we're hearing that domestic violence and things like that are increasing, because when we naturally become overwhelmed, we start fighting out. We try to do things that may not be as healthy as they need to be. So we want to make sure that our mental health and our stress levels are okay, that our stress levels are reduced, and that our mental health is okay. If you can, talk to someone, and keep looking forward. Some other, reaching out, as I said, exercising, getting out and walking, doing those kinds of things. Practice some deep breathing exercises. That does not just affect your physical body, but it also does a lot for your immune system within itself. So, doing those kinds of practices, utilizing YouTubes if you can, or some other, we have access to way more capabilities now with our smartphones and with our TVs and our computers than ever before. So utilize those things if you can. And for more information, these are just some of the information sources. The CDC, the OSHA, Occupational Safety and Health, the World Health Organization, our National Institute for Occupational Safety and Health, as well as NIEHS Worker Training Program, which is where this training falls under. We want you to go to viable resources and not just rely on social media, because you're going to hear all kinds of false information from the news to social media to some of these other outlets. You want to take a look at some other resources. Go and research information for yourself. Don't work for it. Go and look for yourself. We just want to take this time now to go ahead and do that training poll that we started with. So the same 5 questions are going to come up. If you can take the time to answer these, we would greatly appreciate it. And then we're going to get ready for our closeout. Remember to scroll down to the last question as you answer this poll. And Ms. Williams, when the results are in, if you can post those, please.
All right, you guys. Well, thanks, Harry. Have a good evening.
We're not quite done. Okay, so we're taking a look, and we thank you all for participating. It looks like on question number 3, we still have some question about whether or not the coronavirus can spread through mosquito. Well, let me read each of them. Let me go back to the top. One of the practices used to mitigate COVID-19 is, and it was multiple choice, hand washing for 20 seconds or practice social distancing of 4 feet. Remember, it's actually 6 feet, so that part was incorrect. The hand washing for 20 seconds is the actual answer. So you want to practice hand washing for the 20 seconds. Question 2, pandemic means a microorganism has spread worldwide and infected a large population of the world. That is actually true. Remember, we talked about that. It affects a large portion of the world. The coronavirus cannot spread through mosquito bites. And it might have been the way people read it, but the key is it cannot spread through mosquito bites, and that is true. It cannot. Surfaces that are frequently touched by many people should be disinfected often. Everyone got that. That was 100%. And then, which is better at preventing transmission of the coronavirus through contacting or touching? Hand washing with soap for 20 seconds. That's another one, 100%. So thank you so much for your participation. And that does show you that we were able to get some information to you. So we just have a couple more slides. We ask that you bear with us for a couple of minutes. So in closing, once again, this is not a substitute for any industry or job-related policies or skills training. This is to increase your awareness about COVID-19, also to strengthen your preparedness to prevent the spread and transmission of this particular disease. And we hope that it will serve as a supplement to any kind of job-specific training that you may be getting in your actual work activities, and your hands-on skill sets should also be conducted if you're dealing with your workplace. So as a recap, we want to make sure that you're maintaining at least the 6 feet distance that's being recommended, that you're using, that stores and places have those barriers and signs there, that you're adhering to those, and that of course you're modifying any of your work procedures accordingly. And that you're disinfecting. And one of the things I want to mention, because we talked a little bit about disinfecting surfaces, that list of products that I talked about from EPA, you can Google list N, like Nancy, for the names of the products that you can utilize in your home or your work facilities or your places of worship. And they're also what we have a contact time, which means how long you would allow that product once you spray it or wipe it on your, spray it on your surface, how long it has to stay wet. It has to remain wet for a certain amount of time. You want to look at the manufacturer's directions, and it'll tell you for this particular product, that surface needs to remain wet for 5 minutes or 6 minutes, whatever the recommendation is, so that you don't go ahead and just start wiping it down, because in actuality, you might be spreading that virus if it were on that surface. So you do want to adhere to what the manufacturer's recommendations are on that label, so that you are actually disinfecting and killing that particular product. It's called kill time or contact time on that label. So you want to make sure that you're adhering to that. If you have any questions or comments, we hope that you would go ahead and put those questions or comments in our chat box. And that's how we're going to end this evening, by answering your questions. We want you now to engage with us and ask any questions that you may have. Thank you so much. Deborah?
Michelle, we only have 20 people on, so they can just unmute. There are no questions typed in the box at this time. So if you have a question, kindly unmute yourself and ask the question.
Thank you. So if you have any questions, please unmute yourself and ask your question at this time. Any questions or comments?
There was a question that Bruce answered from Miss Allison Russell Smith. I was maybe if Bruce, if you can go over that, just in case it might be a question other people might have, and they might not see it in the chat box because it's kind of done very early in the session.
Which question? Whoa. Which question was that?
So the question was what disinfectants versus hand sanitizers.
Well, all hand sanitizers are not the same. So as Michelle said earlier, if it's isopropyl, what we call rubbing alcohol, it should be at least 50%. And if it's ethanol, it should be at least 70%. Some hand sanitizers can be very toxic to children because just like we had in the news, counterfeit face pieces, there's also counterfeit sanitizers that are being sold, and they have methanol in it, and methanol is very toxic to the human body. The other thing is that disinfectants are very toxic to the human body. They're meant to clean surfaces and not the surface of your hand. The disinfectants can absorb through the skin, especially children's skin, and become very toxic to them. And also, they recommend hand washing with soap and water because you can become sensitized to the hand sanitizer because a lot of them have different types of perfumes in it. And then they're only meant as a precaution when there was not soap and water readily available, but people are just using them more out of habit now. As Ms. Kim could tell you, before we had the pandemic, I wasn't a big fan of hand sanitizers being used in a restaurant. I believe people should get up, go to the restroom, and wash their hands. But we saw a lot of people that sit at the door, sit at their table, and use hand sanitizer. And then you need to understand that hand sanitizers, they will kill germs, but they will not remove dirt. So there are some drawbacks on it. So hand sanitizer should only be used if water and soap are not available and you're in an emergency situation. And be very careful with your children using it.
Correct.
Thank you, Bruce.
Thank you. And I choose to actually, I carry the pump soap with me in the car and a bottle of water, and I do the 20 seconds right there, right outside the car because, I'm not disturbing anything. I don't have to worry about tossing anything away. So, it's based on what you choose to do, but I'm not a big advocate for the sanitizer either.
I have a question for Bruce. Locally, a couple of months ago, I saw a news report where some hand sanitizers, when they left in the car, they catch a fire. What did they have in them to make them combustible like that?
Well, ethanol is a flammable material. Ethanol would burn just as readily as gasoline. And probably if they had enough mixture of the hand sanitizer vaporizing inside of a closed space, and then they receive a spark such as static electricity, you can have a possible fire. But again, it goes back to how you're using the hand sanitizer that is recommended by the manufacturer, and that's the whole thing. You just got to look at it. And that was one of the things that I did when we do HAZMAT training or hazmat training. I will take a bottle of hand sanitizer and I tell them to read the back of it, of the ingredients. And most hand sanitizers are 62%, 64% ethyl alcohol or ethanol. And I said, proof that. They said, what you mean by proof? I said, when you use drinking alcohol, you always proof it by doubling the percentage of alcohol in it. So hand sanitizer is 134 proof alcohol. So just imagine what rum 151 would burn, or some other alcohol would burn. So that, again, that's a flammable material that we're putting on our hand. and it can break down the oils in your hands and cause problems later on. So we should only use it when we don't have water, or like Michelle said, take the soap pump with you with some baby wipes or something like that, and that will help you out in the long run.
Any additional questions or comments? Once again, we thank you so much. We're going to go ahead and proceed with our closeout now. Deborah?
1 second. Can you hear me?
Yes.
Okay.
Yes.
Monique did this slide in the beginning.
Okay.
Talked about the center, yes.
Okay.
So I'll go with the contact information.
Okay.
You can contact us at the Deep South Center. Our physical address is 9801 Lake Forest Boulevard in New Orleans. And our main office number is 504-272-0956. But at your convenience, you can easily go to our website, DSCEJ.org, and you can fill out a information or contact notice on our website to receive information. Thank you so much.
And once again, we thank you all for your participation, and you have a wonderful evening.
Goodbye,
Thank you,
everyone.
everyone.
Good night, everyone.
Bye.
Bye. Thank you.